Chrissy Teigen and John Legend have lost their child following pregnancy complications over the weekend. This heartfelt social media post, Teigen announced that she and her husband had lost their baby boy, Jack. Teigen was hospitalized over the weekend. The couple were about halfway through their pregnancy.
Heartbreaking indeed. The couple has been receiving overwhelming support on social media from fans and celebrities like Gabrielle Union, who also publicly discussed her own pregnancy complications.
And this is not a unique situation. Angie Biersach is joining us right now from March of Dimes NICU Family Support Program Coordinator at Children's Wisconsin, along with Dr. Meredith Cruz. Angie, I think if I read my producer's notes right, you know all too well the overwhelming grief from losing a child, but talk to us about how this in the U.S. is not a phenomenon, especially for women of color.
Exactly. This is really common. The more you talk to women, 1 in 4 women experience a miscarriage, stillbirth, or the loss of an infant up to age 1.
So, Angie, sounds like we may have lost your feed a little bit there, but this, I think, speaks to the importance of early prenatal care and the importance of health care. Is there preventable measures that can be taken, Dr. Cruz?
Yes, so it's a very important, as you mentioned, that women do get early prenatal care so that any risk factors that can be modified early in pregnancy, such as if a woman has high blood pressure, diabetes, that can be monitored and best treated before pregnancy starts. And during pregnancy, we can also adjust treatment regimens for a certain patient. Patients that have experienced a second trimester loss, just as has happened with this couple, also can get ultrasound surveillance in the second trimester of like their cervical length, for example.
And as you mentioned, this is a couple's grief. Angie, can you speak about the support that is available for mothers and fathers when they go through this type of loss?
Sure. So there are great resources that March of Dimes have online, as well as in person, to help families with this. There's a great book called From Hurt to Healing. It's a free online resource if you go to marchofdimes.org. And then we have another wonderful resource called Share Your Story. The more that women and men or women and their partners talk about the loss of a baby, the more comfort they feel and the more support they feel.
And for those who aren't familiar with the organization, I think you gave us some ideas about what's available, but how does March of Dimes come into their homes, or how do they become acquainted with families who need this support?
Sure. So we work across the U.S. and Puerto Rico. We work with hospitals and clinics and health agencies that are trying to get as many women and many babies and many families as healthy as possible. We partner with local agencies here like Children's Hospital to provide support to families who are in the hospital setting. We provide supportive pregnancy resources for women when they're pregnant. And then after the birth of a child, if they need a neonatal intensive care unit stay, we have on-site support to comfort and educate not only the families, but also the staff that work with the families in the hospital settings.
Dr. Cruz, Angie Biersach, thank you for the work you do through the NICU and March of Dimes. For our viewers, more information about March of Dimes, you can find it on our website, tmj4.com.